The Southwest Utah Public Health Department serves 5 counties, and while seasonal flu shots are now available, the encouraging news is that 3 vaccines could also soon be here to ward off the severe invasion of COVID-19.
And as the vaccine rolls out, and we may see those actually start arriving in the next couple of weeks in Utah, we'll go in those small amounts to frontline healthcare workers first. Those are the priority. And after they have done that, the next priority recommended by the CDC will be long-term care center patients.
Vaccines for the rest of the public will more than likely be available sometime early next summer.
It's very likely that COVID-19 vaccines for everyone will be no cost or a very nominal cost. People have asked, will it be mandated? Not in Utah. Of course, we thought we wouldn't see any mandates in Utah, but mandating anything usually is it should be a last resort because it doesn't generally tend to work large scale. People don't like mandates. Our preference is to educate people and get people to make good healthcare decisions for themselves and their family based on their information, not because the government says to do something.
But Heaton said even though cases are high in virtually every county statewide right now, Utah is among the best in the nation among mortality rates due to COVID-19, with 0.5%. Those over age 65 that have underlying conditions are most susceptible.
Right now we've got 10 outbreaks in long-term care centers, 7 in Washington County, 3 in Iron County. That's the place you do not want this disease to get, and so unfortunately a lot of our more severe complications and deaths have come from residents of those places because 1, they're elderly, and 2, they've got long-term health conditions, and those are the 2 things that make it much more likely that you will have complications and perhaps even die from COVID-19. They're finding now that a significant number, maybe even up to 40% to 50% of the spread of coronavirus is from people who are asymptomatic, meaning they haven't developed symptoms yet in that first 5 or 7 days, or they may never have symptoms, but they're still spreading the disease. So that's where the effectiveness of masks comes in. You wear it just in case you're infected, and you wear it to protect that vulnerable population from your respiratory droplets.
While masks are still recommended, Heaton said future shutdowns are not.
Any further shutdowns are not recommended, not only by us but by the World Health Organization, who have said shutting things down across the board are ineffective and probably will do far more damage than a more refined plan of targeting the protection towards the vulnerable populations.
And most schools in southwest Utah are still open as the spread isn't that high among children. And as far as COVID-19 being just like the flu, Heaton said it's far worse.
COVID-19 pandemic is far worse than a seasonal flu year. For instance, I think last flu year we had 5 deaths of local residents of our community, and we've had 93 so far, and it's not over yet of the COVID-19 pandemic. So it is significantly more serious than the flu.
Heaton said it's unlikely to get COVID-19 twice. However, it's not known how long individual immune systems will keep it at bay.
So we know it's possible to get it again in those rare circumstances, but we don't know how long that immunity lasts, or if the disease has slightly mutated maybe since the last time you've had it. So it is recommended that even though you've had it, to still get the vaccine, and maybe you'll have even that extra immunity. Who knows at this point? But
so far, an estimated 1/5 of people who have contracted COVID-19 have long-term effects. One new treatment for lessening the effects of COVID-19 comes from blood of those who've already had it.
You've heard that people, if they're infected by COVID and it's documented, they can go and donate their plasma and make twice as much. What they're doing with that plasma, though, is they're making that into a medication where if it's given early on in the infection, it can decrease hospitalizations by 75%. In a person. And so the targeted person there would be your vulnerable person over 65 with health conditions, test positive for COVID with symptoms within the first couple of days. If they can get that antibody treatment, that's a remarkable development.
While the novel coronavirus was first thought to have come to the United States in late January of 2020, there's now evidence through antibody tests that it was here way before that.
It's now been determined, what some people have suspected, that COVID-19 was likely in the United States in December, several weeks before we were first notified in January. And so it was actually probably circulating before China even recognized that they had official cases. And so antibody testing is useful for large-scale research studies, but as far as you wanting to know, did I have it or not, not a clinically trustworthy test. It's more of an informational research test.
Heaton said antibodies begin developing about 1 to 3 weeks after the infection hits the body. He encourages those who are sick or have been exposed to be tested and to quarantine to stop the spread.
You can find, just as a consumer now, drugstores that offer a valid antigen test. And if any of those tests, those 3 tests are positive, they are part of the reporting to the state. And we get those numbers so that we can keep track of how many people are positive in each of our 5 counties.
In Southwest Utah, Melissa Anderson, Community Education News.